John, I just wanted to say thank you very much for clarifying that Medicare. I just can't wrap myself that you guys are eventually going to get Medicare. Don't forget, I'm Canadian. As a Canadian, we've always lived with it. I'm only 35, and it was here before I was born. Although it was an uphill battle for the people that wanted it done because they had to fight hand over fist to make sure it gets implemented and that it stayed. Um, I can't gripe about it, although many people will, for the simple fact that it has its pros and cons. Mostly, the pros are that you don't pay for your basic medical care. The cons are that you're also subjected to the lack of a better word, internal laws of physics relevant to medical care. If you're seeing a medical doctor, your family doctor for a referral, for example, it can take a longer while for it to happen. If there is something that's more urgent, though, I've seen enough to believe that medical professionals worldwide, be it in the U.S. or in Canada, in these two particular cases, are quite adept at making, hopefully, positive choices to affect their patients' lives in a proactive and beneficial manner. Diseases that are rampant, that are easy to catch, need to be diagnosed quick enough. My mother was one of those fortunate few that she went through breast cancer. She was diagnosed with a 5 millimeter growth in her breast. It was removed, biopsied. It was found to be a non-malignant carcinoma, or not a carcinoma, but I can't remember the exact terms, but that doesn't change the fact that because of our system and because of the way it was done, the fact that my mother also played a pivotal role in her own healthcare by reading up, making sure that she was pressuring doctors into questioning their own designs, their own items. That's all part of the medical costs. If you don't take care of your own health when you're sitting with your doctor, and if you don't put a demand politely with your medical professional, if you don't question, if you leave it all up to them, if you don't learn anything, you'll end up possibly causing yourself inconveniences, either medically, pocketbook wise, or just all around ickiness is possibly the best way of putting it. But fret not, because for you guys it's going to be beneficial. For those that can't get any satisfaction medically because of insurance woes. I think that's the biggest thorn in America's side when it comes to healthcare insurance. It's just not moral. I've never been able to accept in my mind's eye any companies turning away someone after they were discovered that they had a specific disease or a specific health issue that would bar them from receiving insurance. And like John said, like you said, John, it's going to be as mandatory for that than anything else, because it's your health, your life. You only have one. Your family only has one of you. Any friends or loved ones also have one of you. And if you've got pets, they're part of your family. They only have one of you. So please, don't scream the sky is falling. There's no good time to be the boy who cried wolf. And once more, John, thank you very much for clarifying it. Have a nice one. And DFTBA. Don't forget to be awesome, because John is.